Today we're going to review the new clinical practice guideline for treatment of restless leg syndrome and periodic limb movement disorder. This was published by the American Academy of Sleep Medicine, or AASM for short. This guideline was published on September 26, 2024, and the objective is to establish clinical practice recommendations for treatment of restless leg syndrome and periodic limb movement disorder in both adults and pediatric patients. This guideline was developed using the Grading of Recommendations Assessment, Development, and Evaluation Evidence to Decision Framework, also known as GRADE. This framework categorizes recommendations by the strength of recommendation, either strong or conditional, as well as the certainty of evidence, high, moderate, low, or very low. Throughout this video, we will use the abbreviations RLS to refer to restless leg syndrome and PLMD to refer to periodic limb movement disorder. So starting off, there are a number of good practice statements separate from recommendations. The following good practice statement is based on expert consensus, and its implementation is necessary for the appropriate and effective management of patients with RLS. In all patients with clinically significant RLS, clinicians should regularly test serum iron studies, including ferritin and transferritin saturation. The test should ideally be administered in the morning, avoiding all iron-containing supplements and foods for at least 24 hours prior to blood draw. Analysis of iron studies greatly influences the decision to use oral or IV iron treatment. Consensus guidelines, which have not been empirically tested, suggest that supplementation of iron in adults with RLS should be instituted with oral or IV iron if serum ferritin is less than or equal to 75 nanograms per milliliter or transferrin saturation is less than 20%, and only with IV iron if serum ferritin is between 75 and 100 nanograms per milliliter. In children, supplementation of iron should be instituted for serum ferritin less than 50 nanograms per milliliter with oral or IV formulations. These iron supplementation guidelines are different than for the general population. Adults with RLS. The AASM strongly recommends, with a moderate quality of evidence, the following for use in adults with RLS: gabapentin enacarbil, gabapentin, pregabalin, and IV ferric carboxymaltose in patients with appropriate iron status. The AASM conditionally recommends, with a moderate quality of evidence, the following for use in adults with RLS: ferrous sulfate in patients with appropriate iron status, and extended-release oxycodone and other opioids. The AASM conditionally recommends, with a low quality of evidence, the following for use in adults with RLS: dipyridamole, bilateral high-frequency perineal nerve stimulation. The AASM conditionally recommends, with a very low quality of evidence, the following for use in adults with RLS with appropriate iron status: IV low molecular weight iron dextran, IV ferrum oxylol. The AASM conditionally suggests against the following with a moderate quality of evidence: standard use of pramipexole, standard use of ropinirole, and bupropion. The AASM conditionally suggests against the following with a low quality of evidence: carbamazepine, valerian, valproic acid, and the standard use of transdermal rotigotine. The AASM conditionally suggests against the following with a very low quality of evidence: standard use of levodopa, clonazepam. In adults with RLS, the AASM strongly recommends against, with a moderate quality of evidence, the use of cabergoline. Now we'll talk about special adult populations with RLS. In adults with RLS and end-stage renal disease, the AASM suggests the use of gabapentin. This is a conditional recommendation, very low certainty of evidence. In adults with RLS and end-stage renal disease, the AASM suggests the use of IV iron sucrose in patients with ferritin less than 200 nanograms per milliliter and transferrin saturation less than 20%. This is a conditional recommendation, moderate certainty of evidence. In adults with RLS and end-stage renal disease, the AASM suggests the use of vitamin C. This is a conditional recommendation, low certainty of evidence. In adults with RLS and end-stage renal disease, the AASM suggests against the standard use of levodopa. This is a conditional recommendation, low certainty of evidence. In adults with RLS and end-stage renal disease, the AASM suggests against the standard use of rotogotine. This is a conditional recommendation, very low certainty of evidence. And now, adults with PLMD. In adults with PLMD, the AASM suggests against the use of triazolam. This is a conditional recommendation, very low certainty of evidence. In adults with PLMD, the AASM suggests against the use of valproic acid. This is a conditional recommendation, very low certainty of evidence. And now, children with RLS. In children with RLS, the AASM suggests the use of ferrous sulfate in patients with appropriate iron status. This is a conditional recommendation, very low certainty of evidence. So there you have it, a recap of the new AASM guidelines for treatment of restless leg syndrome and periodic limb movement disorder in adults and children. For more information on this guideline, or to view other resources, visit us online at GuidelineCentral.com or download the Guideline Central mobile app available on iOS and Android devices. This has been a Guideline Central production, and we'll see you soon for the next one.